Very good. Well, good evening and welcome to the Adult Children of Aging Parents, or ACAP, program this evening. Tonight's program is anxiety, depression, and aging. And hopefully everyone's settled into a warm space this evening and comfortable. And we appreciate you being here and kind of taking a break from the winter weather outside. My name is Bruce McReynolds, and I'm the chapter coordinator of Adult Children of Aging Parents here in Guilford County. If you've joined us in the past, welcome back. We're glad to have you. If this is your first time, special welcome to you. We appreciate you being with us this evening. For those that may be new, just to know that ACAP Guilford County programs are presented each month on the third Thursday at 7 p.m. So we definitely would love to see you back each month. Just to kind of give you a little snippet into some of the topics that we'll be looking at in the coming months. On March 18th, we'll have a special program on nutrition and aging. We'll be looking at the importance of nutrition, the nutritional requirements of older adults, issues and conditions that impact adequate nutrition, and some of the strategies and resources that we might want to consider in terms of nutritional aspects of our aging parents. In April, on the 15th, we'll look at aging on a fixed income. Some of the resources that might be available to being an older adult on a fixed income, and some of the resources.
I need to charge it. Do you have a box? Yeah.
The what?
A box.
And then in
Oh.
May, if
Thank
you're
you.
not on mute, please go ahead. And then in May, on the 20th, we'll be looking at managing behaviors of Alzheimer's and other age-related dementia. So that's what's coming up for the next 3 months. And again, it's the third Thursday of each month at 7 p.m. If you've registered for this program, just to know that you'll continue to receive invites for upcoming programs. If you're joining us on Facebook Live, we would encourage you to send us an email so that you can register. You can email us at acapguilford@gmail.com. You can also take advantage of some of our expert-led podcasts. There on your screen is the website for ACAP Guilford County, and you can access many of our podcasts from the past there as well. So in order to bring you our monthly programs and in order to support ACAP Guilford County all year long, we have 3 wonderful sponsors that make that possible. So we just want to give a shout out and a thank you to Griswold Home Care, Providence Place, and Mount Zion Baptist Church for being our chapter and our core sponsors to make all of our activities possible all year long. But tonight's program is brought to you and sponsored by a very special sponsor, Caregiver Connect. And we want to thank them for being our sponsor and share with you a little bit about who they are and how they can help. So Caregiver Connect, Inc. is a nonprofit organization that serves family caregivers. Their mission is to embrace family caregivers where they are, to equip them with the needed tools and resources for survival, and encourage them to connect with other family caregivers. Caregiver Connect serves family caregivers in the following core areas. They help with training and education. They partner with local agencies and businesses to provide educational opportunities to help the caregiver better understand, plan, and organize their duties. They help to be a resource in the community. They help families navigate and identify possible resources in the community, allowing caregivers the time to connect with other caregivers. And they also offer support. Caregiver Connect offers several caregiver encounter groups each month. These sessions allow family caregivers time to connect with others and learn that you're not alone, and also just help to support other services and organizations in the community. So again, thank you, Caregiver Connect, for being part of our program this evening. So just before we get started, I'll encourage you to type any of your questions into the chat box located at the bottom middle of your screen. We'd love to hear your questions and comments. So if you'll type those in, we'll get to those at the end of the program. So let's jump into our program for this evening. Again, it's anxiety, depression, and aging. Anxiety and depression are frequently associated with aging. Maybe a result of specific health or medical conditions, or they may be a result of physical and social losses. So tonight we can kind of help sort through the challenges and issues relative to anxiety, depression, and help us understand and differentiate between those two things. Hopefully we'll recognize the characteristics of potential causes and to offer tips for overcoming those. So with that, it's my pleasure to introduce our speaker for this evening, Dr. Nannette Funderburk. She is a PhD, a psychotherapist, and co-owner of the Social and Emotional Learning Group. It's a counseling private practice here in Greensboro, North Carolina. In her role, Dr. Funderburk provides counseling and training to individuals, groups, and organizations. She spent several years working with children, adolescents, and adults who have experienced life adjustment issues, psychological trauma, loss, abuse, low self-esteem, and more. She's also been enjoyed serving and teaching roles at university here in the Triad here in North Carolina. She especially enjoys helping individuals with overwhelming life problems to recognize their root emotions, negative behavior patterns, and the sources of the behaviors in order to make practical changes for a better life. So with that, I'll introduce Dr. Nannette Funderburk.
Hello, everyone. I'm so glad to be here with you today. And I'm so glad that, we all have power, we can connect, we don't have any of the issues that, or at least the people on this call, right, don't have any of the issues that have been plaguing so many recently. So let me jump right in, and I'm gonna share my screen with you. Okay, and then I need to make that. All right, so as you've already been told, we're going to be talking about depression and anxiety in aging and what it can look like, and then even some of how when you have people who are caring for others who are experiencing depression and aging, how that can kind of be a little bit of an issue to overcome, but it can be overcome. So we'll be talking about some of that tonight. So let me go ahead and click here. If there are questions in the chat, I don't know, can I ask that one of you all from ACAP just alert me? Okay, great. I see the head nod. So great. Thank you. So let's look at what I'm going to go over today. So this is our brief agenda here. What is health, first of all? We'll go over that very briefly. Then we'll look at some depression facts. We'll look at some anxiety facts, what causes these disorders, then how to recognize these disorders like symptoms and how it might show up in everyday life, and then how can you communicate about these disorders, whether that's to the person you're caregiver for, whether that's a parent or some other family member, or how do you communicate to a professional, a physician, a mental health professional. Okay, so that's what I'm looking at going over today. And before we oh no, I'm getting ahead of myself. Let me just go ahead to the next slide here. So what is health? The World Health Organization says that health is, and pay attention to this because sometimes I think we get this part mixed up. The World Health Organization says that health or defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if you have a physically healthy body, but you are not healthy mentally or socially, you're not healthy, or the person you're caring for is not healthy. So I think that is a distinction that we have to pay attention to. Okay, so also in seeking optimal health, we're looking at physical well-being only. Mental health is important to optimal overall health. So now I want to look at a video clip. I love to bring in video clips, and I'm bringing you a video clip from one of my all-time favorite shows ever. You see the quote down there. It says, "Why should I be the only one who feels like crap?" Any Golden Girl fan out there knows which Golden Girl that was that said that. That was a quote from Sophia Petrillo, the most senior Golden Girl. And we're gonna watch just a couple minutes. It's literally a couple minutes. It's right at about 2 minutes of an episode of Golden Girls that I think will start to get us into what we're talking about or what the topic is for today. And also, I don't mind, let me remind myself, did you say earlier, Bruce, that questions were going to be in the chat, or will people also will people do both, put it in the chat and or just kind of raise their hand and say, I have a question?
We can do either, which you prefer. I think if you'll go ahead and put it in the chat box, and then we can call it out to you if we see a question. Okay, so I'm okay with either. I just wanted to make sure that I knew what I was doing from this point forward. So okay, so let me switch over then to my my favorite show here. Anytime I get the opportunity to share my favorite show, I do that. Because when I say it's my favorite show, I have like a DVD box set and paraphernalia here at the house from the show. All right, here we go.
Pop sure loved playing with you kids. Why do I look so upset?
Oh, Ma, don't you remember? Pop was a big fan of Jean Harlow's back then. You hated it when he made sand breasts in front of the children. He was really some character. Oh, look at us.
Oh, boy, your father sure looked stupid.
Stupid, Ma, this was one of your favorite pictures. Oh, Pop looks so proud.
The idiot's dressed like an organ grinder.
Yes, he is. Remember, we had no money, and he refused to go on assistance. He vowed that he would take any job to feed his family, and we had meat on the table every night. I don't know how we did it on 10 cents a day. Where's the monkey? Oh, look, there you are, stirring sauce.
Ah, my old kitchen.
Yeah, and there are the potholders Grandma made, your pasta maker. Ah, the pantry. Remember what Pop kept behind the pantry door?
Yeah, he carved a giant heart there that said, Sal loves Sophia.
No, Ma, it was our height measurements. He kept track of them on the back of the pantry door.
Dorothy, that was my kitchen, that was my Sal, and he put the heart there because he loved me. That I remember.
I'm sure you do. Listen, Ma, why don't we talk to your doctor and see what he has to say?
Yeah, well, maybe. I don't remember half these photos. I don't remember Brooklyn. I don't even remember you going off to your senior prom.
Ma, I never went to my senior prom.
Actually, I did remember that, but why should I be the only one here to feel like crap?
Okay, so I'd love to, let me get back to the screen here, the presentation here. Okay, so I'd love to hear from you here. So this video is a small depiction of what getting older, what an older adult may feel like. So first of all, let's look at what did you notice, and let me hear from you. What did you notice about Sophia in this video? Sophia, of course, it was the mother in this video. Anyone, whether you unmute or whether you put it in the chat. Did I see a couple things pop up there? Are you able to look at the chat for me?
So some of the comments in the chat are that she's frustrated. She doesn't share the same memories as her daughter. She doesn't want to see her doctor. She's depressed.
Okay, I'm glad you all are bringing out exactly the words that I wanted you to bring out. Okay, so I'm hearing frustrated, and I'm making note of some of this. I'm hearing frustrated. I'm hearing depressed. Doesn't want to see the doc you mentioned. Okay, yeah, that's exactly what we're seeing. Now, what did we see in Dorothy, the daughter?
Sad, compassionate, trying to be reassuring, empathetic. She didn't argue. She didn't realize that her mother didn't have the same memories. She was finding it difficult to be patient.
And it almost seemed like Dorothy maybe learned or was close to learning a family, maybe one of those parent secrets that the parents know about, but the kids don't know about. You know, when she was talking about when Dorothy said, whatever happened to that monkey, Mom? And Sophia got very quiet and then looked in the other direction. And so the implication was that they may have had that for dinner. That was the implication. But it was like, oh, okay, yeah, the kids didn't know about that. As you get older, sometimes you start learning things about your parents or about your family that you didn't necessarily know before. And that could be a little uncomfortable. It could be discouraging. It could be, it could bring up a whole lot of feelings there. So good. There was also, I could probably go on and on and on about Golden Girls episodes. There was another episode but I'm not going to go on and on. I do want to just mention this one other. because I think it's important. There was an episode where Rose and her mother were coming back together. Rose's mother was visiting, and Rose was treating her mother like a child almost. You know, Mom, don't do this. Mom, you can't go there. Mom, you might get lost. Mom, Mom, Mom. And Rose's mother got quite angry and was ready to leave. But what Rose said was, I'm treating you like this. I'm doing this because I don't want to lose you. So Rose, or the daughter, had a fear of losing her mother because she had already lost her father some years past. And so she was just trying to hold on and savor all of those moments with her mother. So there are so many things that as adult children that start to flip when you become the adult child who is really that caretaker in a particular situation. Okay, so also one of the things I wanted to point out, Sophia said she felt like crap. Now, see, she felt it, she said it in her very Sophia way, but what she was, when people are angry, because there was a section in there where she kind of got a little indignant, and I think someone said that because someone said she was frustrated, and that can be a hint that there is depression present. When that irritability pops up and it's like, well, wait a minute, what just happened here? That can be a hint for you that depression is there as well. So I think Sophia demonstrates it in that classic Sophia way, and it's just, I think, a note that we can all take with us that, you know, they don't feel good either in the changes that are occurring. Okay, so now that as I mentioned the word changes, let's continue talking about changes here. There are changes everywhere for that older adult. There are friends and loved ones who may have passed away. Their mobility feels different. And you don't have to be an 80-year-old adult, a 70-year-old adult to know that mobility feels different as you get older. Physical health changes. You know, you start going to the doctor and it seems like there are more and more tests that are supposed to be run. And then it's like, oh my gosh, they're finding more and more stuff that seems to be wrong with me. Is my body betraying me? The world is changing. I know, you know, with all of the technology changes, it can be really hard to keep up. It can be hard to keep up for anyone, but it can especially be hard to keep up if technology was not really, you know, using technology was not the way that you did life. You know, we have Wi-Fi now, we've got smartphones, we've got smart TVs. And I can remember one older adult saying to me one time, well, just give me a dumb phone then, because I don't like these smartphones. And I had to chuckle because I said, I can see why, you know, it might feel that way, because it's like, well, wait a minute, this thing is supposed to make phone calls. What's all this other stuff that it's doing? And also, people can treat you differently. Our society does not relish getting older the way some societies do. Our society relishes youth more than it relishes getting older. And that does not always feel good. So sometimes people are ignored. Sometimes people are, believe it or not, elders are abused. And so there can be physical abuse, emotional abuse, there can be neglect, and financial abuse. Financial abuse can definitely occur during these older years because, you know, typically they've amassed a little bit more. Hopefully they've amassed a little bit more. I know that's not the case for everybody, but in many cases they've amassed a little bit more, and there are people who are trying to take that away from them. So you want to just pay attention to, there are changes everywhere. There are changes going on everywhere for them. So let's look at some depression facts. And let me pause really quickly before I go into that. Are there any questions that I need to respond to from the chat?
I don't see any.
Okay, all right, cool. So depression is less common in older adults than in other segments of adult population, okay? So keep that in mind. I'm comparing it to the older adult population to other adults who are younger than they are. So it's less common than other adult populations, but, and this is the caveat, detection rates of these disorders are lower. We're not detecting it in the elders in the same way that we are in people who are younger. Patients are less likely to seek help for mental health symptoms. So I think that's another reason that it may seem like depression is not as common in older adults. And then older adults are more likely to seek help for their physical symptoms that may have a mental health root versus addressing the actual mental health issue. There are a lot of mental health issues that are what we call psychosomatic. So that means there is something psychological going on and it's expressing itself in a physical way. Somatic is the physical stuff. So it's expressing itself in a physical way. And that can happen in younger adults or younger people too. For example, when you are stressed at work, you might get a headache. That's a very simple example of a psychosomatic symptom. So of the mental health disorders, depression is the most prevalent problem amongst older adults. So notice what I was saying there. They're not going in oftentimes to seek treatment for it, but it is quite prevalent within that group. So there's like this disconnect here with them getting a diagnosis. There's a disconnect between getting a diagnosis and then actually being able to be treated for that diagnosis. So that's a little heartbreaking right there, because there are people walking around, there are older adults walking around that are suffering from depression, but not getting any treatment for it, and it is treatable. Okay.
Doctor, there's a couple
Yes.
comments or questions. One is, what age group are you defining as older adults?
So good question. So in some of the research, I even hate to say it, but they look at older adult as 55 and older. Now there is other research that will look at older adults as 60 and older. So that's the short answer to that question.
There was a comment about, there being a stigma about mental health issues in an older generation.
Yes. There that is there. I mean, just bottom line, yeah. There is stigma in a lot of different populations about mental health. Definitely the past year has made changes in that. People are addressing mental health issues more than they have in the past. But I would still say that amongst the older adults, that is, they're doing so less. And I think I would say it's not brought up to them either, so when they go to their physician. So you notice one of the bullets on there was talking about they show up for all of these physical symptoms, but it's not always questioned. Depressive symptoms are not always checked out when there are all of these physical symptoms, especially if they are not going to the same physician. So if they're showing up in the emergency room and you're not getting the same physician every time, or you may not have access to all the records, or just however it is that it shows up, it might not be evident that there's a mental health situation going on.
Mm-hmm.
Okay, was that all? Is there anything else I need to respond to?
I want to ask, who should older adults see for mental health rooted symptoms?
Well, you can start with your physician just to rule out other things. But then after that, absolutely, you want to go to a mental health professional, because that's what our specialty is. That's what we train in. And there are people who get training specifically in a geriatric population. Although I will not say that that is 100%, necessary to have someone who has specific geriatric training. It definitely is not going to hurt anything to do that. And also, even though there are those people that exist, I would not say that there are a lot of those people who exist. So I don't want you thinking you have to find someone who has a geriatric specialty and then you go out there and start looking and you don't find a whole lot of people like that. Okay, thank you. Good questions. A few more depression facts. Older adults with depression also visit the doctor and emergency room more often. Again, those physical symptoms. We can have a lot of psychosomatic stuff. People who are depressed, but also people who are anxious. They may have more headaches. They may have more GI issues. So if you have some other physical issue already, and then you combine that with the physical things that your mental health disorder are bringing into play, that can really just be this perfect storm of that happens within that person. So, but as you can imagine, that older adult, they're feeling like, what in the world is going on with me? I don't feel good. I don't like this. I don't feel right. And then that's where you might start to see some personality changes too, because now they're like Sophia said, why do I have to be the only one that feels like crap? So they don't feel good, and then they're just not in the best moods. Another thing to pay attention to, though, are medication changes. Medication changes can absolutely can induce certain mental health disorders and can impact personality. So if there's something that seems to happen like that, and you feel like, ooh, this is not the mom I know, or this is not the auntie or the dad or the whomever that I know, and there's been a med change, you definitely do want to check into that med change, talk to the physician, see what side effects that there are there for that medication. Older adults with depression also incur higher outpatient charges because they're just going back and forth to the doctor a lot. And then when they're in the hospital, they have longer hospital stays. There is more that is, the potential is that there is more that could be wrong with them. So if you get them in the hospital and the hospital finds, that there's this going on and there's that going on, they do have to check for some of those things too. So it could lead to a longer stay, which nobody really likes staying in the hospital for any length of time. Okay, so let's keep going. More depression facts. Depression is not, and I repeat, not a normal part of growing older. In 80% of cases, it is a treatable condition. Unfortunately, though, depressive disorders are a widely under-recognized condition, and they're often untreated or undertreated amongst older adults. So these are just a few of the depression facts that hopefully can get in your mind and maybe stir up some questions, stir up some food for thought for you. I'm going to slide on over to anxiety if there are no more depression questions or comments. Nope.
No questions. Nope.
Okay. All right, good. So with anxiety, anxiety is that feeling anxious or feeling nervous, right? And it's common for people of all ages. And I normally say this a little earlier in presentations. Anxiety and depression, I call them the common colds of mental health. So if there's going to be a mental health issue, I would be willing to bet that it's going to show up as depression or anxiety for a majority of people. So just keep that in mind. And also that might be a shareable fact for you with your older adult, because sometimes it seems like when I'm making that diagnosis of depression for someone and they hear that D word, they just feel like depression. No, don't tell me depression. And they feel like, oh, I can't be depressed, when it's common. It can be common. So there's not the need to, feel like you've done something wrong or your life is over, or I can't stand when people say, oh, I'm not crazy. And I'm like, I know you're not crazy. You're just depressed or you're just anxious, whichever one it is. Yes, they are very, very common. But continuing on with anxiety, feeling anxious can help us handle problems and strange situations and even avoid danger. So, anxiety, just the crux of anxiety is not terrible. It's when anxiety increases in frequency. It's when anxiety becomes overwhelming. It's when anxiety affects our daily tasks and social life and our relationships. That's when it might be an illness. Okay. All right, let's keep going here. Depression often goes hand in hand with anxiety. I will call them cousins sometimes. As you can imagine, when someone is really anxious, and you see this next bullet talks about how it can be debilitating and reduce overall health and quality of life. So if you're walking around really anxious, and let's say you're unsure why you're anxious, a lot of times people don't really know why they're anxious. That can make you feel bad. And if you're continuously in that cycle, you can bounce back and forth between that anxiety and depression. No, that is not bipolar disorder. I just heard somebody in the back of my mind saying, is that like bipolar? And that's not bipolar disorder. So keep that in mind, that they can go together, and it's not, it's just not uncommon for them to go together. Also, anxiety is strongly linked to memory. So when a person is anxious, it can be easy for them to, not remember some things that used to be on their plate. I like to look at it as like, think about a plate that you might have at Thanksgiving dinner that's full of, all your deliciousness that you're going to eat at Thanksgiving dinner. And you've put a little bit of everything on your plate, and then you go to get that roll that you want to put on there, that the last thing that you want to put on your plate, and you try to put the roll on there, and then it just the bread roll on there, and then it just rolls right on off because there's not enough room on the plate. Anxiety can be kind of like that. With anxiety, you're paying attention to all of these things, and everything just feels like, oh my gosh, what am I going to do about this? And what am I going to do about that? And how is that going to be handled? And when you're trying to remember that one fact, that somebody's name, or did I take the meds? That might be the thing that's like the bread roll, and it falls right on off the plate. So it can negatively impact memory. And it can also, significant anxiety can also contribute to amnesia and flashbacks of a traumatic event. So if there has been a traumatic situation that has happened in a person's life, and a lot of times in an anxiety-filled event, in a traumatic event, we will become anxious, right? So if a person gets significantly anxious later on, some days, weeks, maybe even months or years later, if they start to feel significant anxiety, it might feel like, oh, that's what I felt like when I was in that situation back then, a year ago or 2 years ago or 10 years ago. So it feels like they're right there in that traumatic situation again, and their body may respond the same way. Their body may respond as though they're in that traumatic situation again. So the memories may not be there. So this can appear to mimic dementia. It might not actually be dementia. That's why I say you may want to go to your physician's office first to have some of these things ruled out. And then you can work on treating whatever the real thing is to be treated. Okay. We're going to continue to go. How am I doing on time? I didn't check that before I started.
About 15 minutes.
15 minutes left? Okay. All right. So what causes these conditions of anxiety and depression? New medical diagnoses. And I don't think you have to be an older adult for a new medical diagnosis to push you into one or the other of those categories, right? Other medical or mental health issues. So if that older adult already has a mental health issue or already has a medical issue, those situations can start to tickle the roots of anxiety, and they can kind of play on each other. Extreme stress or trauma. Anybody had any extreme stress in the last year, 2020? And you know, right, we're almost bumping up at a year now, right, of all of the COVID changes. So that has been extremely stressful to make all of the changes that we've had to make in our world. And that's not the only type of extreme stress I'm talking about, but it's the one that's biggest in our world right at this moment. Bereavement. And then complicated grief or chronic grief. So complicated or chronic grief, though, that's the grief where someone just feels like I can't get through it. I can't get over it. I can't work through it. So that might be a grief-stricken person who has been that way for quite some time. That might be not just some weeks or months. It might be some years of being in that low place, and that can cause some of the other mental health disorders. Alcohol, caffeine, drugs. Sometimes we think that older folks are not going to connect to those types of things, but they can, and they do. Not everyone, but some will. Some absolutely will. A family history of anxiety disorders can cause an anxiety disorder in you. And then neurodegenerative disorders, so that's, where your brain is deteriorating, basically, like Alzheimer's or other dementias, that can trigger anxiety or depression as well. Okay. So how am I going to recognize this? So with anxiety, you want to look for these symptoms that I'm going to go over in just a second, and they need to be present more days than not for at least a period of 6 months. And that's what our diagnostic manual, that's how our diagnostic manual looks at, can we even make a diagnosis of that for a particular person? So we're looking at excessive worry or fear. So it's not worry or fear that is appropriate. It's that worry or fear that goes a little overboard. Okay. Refusing to do routine activities or being overly preoccupied with a particular routine. That can start to lean towards some anxiety. Avoiding social situations. Sometimes they don't want to be seen. Because they don't feel like they're looking their best anymore, or they're not moving their best anymore. Being overly concerned about safety. An example of that one that I've seen recently, when an older adult is fearful of falling, that can then keep them from moving, right? They're going to just stay still or stay in one place or not move very much because they don't want to fall, especially if they have fallen in the past. That is not pleasant. And there can be a lot of negatives that come from falling. So they will decide that they're not going to move anymore. Then what happens if we don't move? We kind of lose even more mobility, right? So they're anxious. So now they're anxious about falling. So now they're not moving. When they don't move, that decreases their mobility. When their mobility is decreased, now their independence is threatened. If their independence is threatened, they now need more people coming in, helping them out. Do you see how it's just like a slippery slope on that, being overly concerned about safety there? Having a racing heart, shallow breathing, trembling, nausea. That can be symptoms of other stuff too. That can be symptoms of heart issues or stroke. So you can see how these older folk may end up in the emergency room sometimes because they're thinking, oh my gosh, I'm having a heart attack, or I might be having a stroke. Poor sleep, which doesn't help anybody. We need to sleep well. Sleep is, there are studies, there's research out there that compares a sleepy brain to a drunk brain. So if any one of us are not getting enough sleep, that's a negative. And it could be a sign of anxiety. Muscle tension, hoarding and collecting. It's like, just in case, I might need this. Let me keep that just in case. Depression can be a symptom. It can show up with anxiety, and then also self-medicating. You can self-medicate with alcohol or other depressants, but you could also self-medicate with sugar and caffeine. So drinking a lot of the coffee, drinking a lot of tea, eating a lot of the sweets and cakes and pies and things like that, those can also be some signs that you are just trying to make yourself feel better, is what that self-medication piece is about. Okay, next slide here. So how to recognize the depression symptoms. So these are all depression symptoms that are listed here below the break there. So just know that for symptoms of depression, now we're only looking for these things to have lasted at least 2 weeks. So that's different from anxiety. That's different from anxiety. So there might be disturbed sleep. Either you're sleeping too much or you're sleeping too little. Changes in appetite, which will make changes in weight. Weight's either going to go up or weight's going to go down. Physical aches and pains, and they might not really have a true organic cause. That, oh, my back is hurting. Oh, why do I keep getting these headaches? Or I've got this, pain in my neck here, which that is oftentimes what leads to the headaches. Lack of energy and motivation. Irritability, you always hear people, it's almost the stereotype of the ornery older person. And that person, might just be depressed. They're not trying to be mean. They're just not necessarily feeling good. Loss of pleasure or interest in any of the things that you used to do. Feelings of worthlessness, feelings of guilt. They're at a stage in their life where they're looking back on, did I do it right? Did I do enough? Oh, I shoulda, coulda, woulda done all of these things. Difficulties with concentrating. Noticeable restlessness. Definitely, I'm going to jump down, definite changes in sex drive, but then also, well, I jumped to that one because a lot of times we don't think of older adults as having a sex drive, but older adults can have a sex drive. And if there's a marked change in that can be a symptom of depression. And then the recurring thoughts of death or suicide. With if there are friends who are passing away, if their life has changed in a way that, they didn't expect, that can bring up those thoughts of, well, everybody else is gone. Why am I still here? And that is, that's not comfortable. That is not a comfortable thought for that person to have, nor for anyone who might be with them or around them. So before I move on to, talking to and communicating to the professionals, this is the last part that I'm going to go over. I just want to make sure that there aren't any other pieces I need to stop and either clarify or answer a question about. Okay.
So I think we actually did have one question.
Yes.
Someone asked if you could address how to improve sleep quality and talk about the importance of exercise.
So with sleep, you definitely want to try to address what is the cause of the poor sleep. Are they thinking about something? Was there just a recent change in their world? Was there someone who passed away? Or is there a health issue? So you want to try to get at addressing, or thinking about what is the cause for the lack of sleep or the not being able to sleep. If there's not a behavioral reason, if there's not a social reason, then you want to talk to the person's physician to, ask about a particular disorder. Are they, because if they already have a diagnosis of X, Y, or Z, that could be a side effect of a disorder, a physical disorder. So you want to check in with physicians as well. And then the physician can prescribe something to help them to sleep, or can talk about over-the-counter options to help them to sleep. If that person is able to exercise, and exercise will look different in an older adult, but if they are able to do something to move, that can help with sleep, because you're going to, hopefully you will tire yourself out a little bit. So that might need to be something that you check with the physician about as well, just to make sure of what are the things that I do. What are the things that I'm cleared for, basically? You don't want them to go out and try to do something that would ultimately hurt themselves. So I would check with the physician on the exercise piece, but whatever you're cleared for, then go for it. Anything else before I move on with the how to talk to folks?
No other questions?
Nope. Okay. All right, so how do I communicate about this? So how do I communicate to the parents, or how do I communicate to the person I'm caregiving for? You see this first bullet here that is bolded? Be calm and reassuring. And then the next part, check your tone and reserve judgment. Being a caregiver is not an easy job. So because you have already had different things thrown at you just in the course of a day, communicating back with them, especially if they are maybe not wanting to hear what you have to say in that moment, it can be a little, your emotions can rise. So you want to make sure that you are calm, you're in a reassured place. That might mean you have to go somewhere else and get your own support system, so that you can make sure that you're calm with your person who you're caring for. So that first bullet, I can't stress it enough. You want to be calm and you want to be reassuring, because mental health issues can be addressed. And in many cases, they can be addressed and then it can dissolve, go away. So you want to reassure them that, they're not the C word, crazy. That's the word that gets thrown out all the time. And that's, nobody wants to be called that. Acknowledge their fears, but do not play along with them. So if they're afraid of walking because they've been falling, then okay, you can acknowledge, I can see why you might be fearful of walking right now, because you have fallen a couple of times. Let's talk to a physical therapist. Let's practice going up and down the steps, and I'm going to be right here with you. Do some things to acknowledge what it is that they're feeling, because when you don't acknowledge a person, it's like I'm ignoring you, and it's like you don't matter, but they do matter. This is their life. So acknowledge the fear, but don't play along with it. So we're going to acknowledge that they are fearful of falling, but we're not going to say, okay, no, you never have to walk again. Be supportive, show patience, encourage them to engage in social activities. And I know that will look different. That will look very different now in the age of COVID. But even if there are things that they can call into, there are a lot of things, community services. When I'm thinking of like worship faith-based services right now. And it seems like other things are escaping me at the moment, but those things, even if they can call in and hear what's going on, that's a way of connecting. Whether they get to talk or not, it's a different story. But even just connecting, hearing what's going on, having that liveliness and life around them can be helpful. And then offer assistance in getting them help from a physician or mental health care professional. Sometimes they just don't know what to do. They want the help, but they just don't know what to do. When you're talking to the professional, when you're talking to the physician or mental health professional, you want to inform that professional about changes. Have there been changes in daily routines? Are they avoiding going to this place or that place? Are they avoiding talking about a certain issue? That you want to make note of that to the professional. Worries, do they seem to be worried excessively? And excessive is not a hard and fast, there's not a hard and fast rule to what excessive is. But if it seems excessive to the others around that person, then there's likely something to look into. Medication, is this person taking a new medication? Or did the dosage change? Or did they are they not taking it all of a sudden? You know, what's going on with the medication? Are they drinking more? And then I always add with drinking, like I mentioned earlier, the sugar piece and the caffeine piece. So are they drinking alcohol more, but are they drinking caffeine more, or are they self-medicating with sugar more? And then have there been changes in their mood? Is the older adult now tearful, or are they totally lacking in emotion? Are they just what we call flat? Do they have flat affect? Those are things that we need to communicate to the professional, because those can mean certain things as far as the diagnostic criteria go. Okay, so I have gotten to the end of my presentation. So feel free to ply me with questions if there are more, or not. It's up to you.
Dr. Funderburk, it was asked if you might be willing to share your PowerPoint presentation with the group, and if so, we
Sure.
forward that out to them. So
Sure. I just need to make note to do it. So let me write that down right now.
any other questions from the audience? It was asked, how do you help your mom when you know she needs help?
Okay. Well, so I don't know in the specifics going on there. And that's okay. You don't have to, go into any more depth about that. But when a person is seeking, when a person recognizes that the older adult needs help, and maybe that older adult is not trying to go for the help, if you as the caretaker could attempt to peel the layer back and like peer in almost to see, what are they afraid of? What's maybe the thought behind this? So what they say to you is this, but what's maybe the thought behind that? Are they fearful? Do they have a wrong idea about something? With all of the, with the vaccine being so, such something that is such present, it's right here in the present with us right now. There's some people who are, yes, like, oh, all gung ho, I want to get the vaccine. Others are like, nope, not me. And so for those people, if you're wanting your older adult to get the vaccine and that older adult does not want to get the vaccine, what are they thinking about the vaccine? Are they thinking that, well, it was developed too fast, or it's not going to work for me because, and then, have them tell you what the because was. Or I've seen some older adults who, because of their other health issues, they're thinking, well, no, I don't want to take that vaccine because, I just had that heart attack, and how is it I heard that the vaccine does stuff with your heart. Now, whether that's true or not, we don't know, but you want to see what's behind the thought for them. I hope I answered that question for you. There wasn't as much there as maybe I could have, might have needed to answer specifically. Go ahead.
The question was asked, how do you know the difference between anxiety, depression, and dementia?
Dementia will have other markers, like physical markers. So that's where you want to go to your physician first. And there could be like an MRI or functional MRI done to see what are the changes that are in the brain going on. And there would also be questions that they would ask about changes in behavior, changes in personality and mood too. And that would be different than, and those answers would be different than if it was run-of-the-mill anxiety or depression.
Okay. When is it okay to communicate with a loved one's primary care physician without the loved ones knowing?
Oh, that's a hard one. That's a hard one because, you know, since they're adults, they get to care for themselves, right? Technically, if you can have the conversation to attempt to join with them. When I say join with them, I mean kind of like what I was saying in this prior slide. When you have the conversations with them, approach it, you know, check your tone, make sure of how you're coming across to them. And you might be trying to be as nice as you can, but the way they're perceiving it is maybe differently than the way you're putting it out. But bottom line, you want to be able to join with them, connect with them in a way that will make you more allies versus coming against each other. So that's like, you know, the spoonful of sugar helps the medicine go down, right? The other side of it, you know, is connecting in a legal way and learning about healthcare power of attorney, that sort of thing, so that you can go in and either talk for your loved one or with your loved one.
Okay. The question was asked, do you usually find counseling or medications more helpful with older adults?
I am a proponent of both. Well, let me back up. If medication is needed, absolutely take the medication, or absolutely, you know, go in for that script. Medication is not always needed, though. There can be behavioral changes and social changes that can occur, structural changes that can occur that can shift the way that disorder will show up. So if you don't need the medication, then, you know, it's like you never want to put medication in your body if your body doesn't really need it. But if it does need it, then absolutely both. When I was recently doing a presentation with a psychiatrist, we were kind of tag teaming, and even she was saying, yeah, they go hand in hand. The medication and the counseling go hand in hand. What you don't want to do is try to take the medication to address a mental health issue and not address the root cause of that mental health issue. Because once you stop the medication, the issue is still there.
Mm-hmm. Okay, and one final question. So how much are these issues to addiction problems, not just substance abuse, such as hoarding, connected to addiction?
Okay, say that one more time for me.
So how much are these issues to addiction problems, not just substance abuse, connected to addiction? So I think the question is, you know, I guess, do you find that more of these issues are relative to addiction as opposed to just abusing substances?
Well, a person who is abusing a substance, if they're caught up in that cycle of abusing a substance, there's likely the addiction there. So I don't know if I have the appropriate, I'm not sure that I'm totally understanding the question. Go ahead, were you about to clarify some more for me?
That's all I got from.
Okay. So when addiction issues or when medication issues or drug issues show up in the elderly, you want to look at, and really for anyone, you want to look at, why is the person taking this drug? Why are they medicating that way? Go ahead, was there something else?
Yeah, so the clarification was how much of these issues about anxiety and depression are connected to addiction issues?
Oh, okay. I don't have a stat for you, but that is a good question because there are many times that people are abusing substances because they're just trying to feel better. They're trying to bring their anxiety down or they're trying to bring their depression up. So, like I said, I don't have a stat for you, but that can absolutely happen. And that happens in older adults and younger adults.
And what progress has been made or do you believe will be made to get mental health care more available and covered by insurance?
Can you see the eye roll with that? I think that's an ongoing battle. That's where it's like, and you have to kind of fight that one from multiple sides. So you definitely want to be writing into your Congress people and on a regular basis, you want to be doing that sort of thing. But also you want to be kind of out there being the proponent for using mental health services and using that part of your insurance that covers mental health services, because that does exist, but there are a lot of people who are not taking advantage of that. So once there are more people, I think, who can take advantage of it and then kind of go out and advocate for, hey, you know what, these mental health services helped me and it was very necessary for me or my loved one or whomever to get through X period in my life. It's like the combination of those voices speaks louder than the individual would. But that isn't something that I would look for to have change in the next day or so. That's something that's going to be like an ongoing battle that we have to just stay in that fight.
Dr. Funderburk, our time is up, unfortunately. Lots of great feedback in the chat area, so we really appreciate you being with us. It's a lot of good information. Lots of stuff to think about, and I think some great recommendations as well. So Dr. Nannette Funderburk of the Social and Emotional Learning Group, we appreciate you being with us this evening and for your time. We also want to just thank again our sponsor, Caregiver Connect. Please look them up for some great education and resources for working with older adults. So invite you to join us again next month. Our next program will be March 18th at 7 o'clock, where we'll talk about nutrition and aging. So thanks again for being with us. Have a safe evening.